Hi guys, welcome back to my channel. I've been posting about my pregnancy and stuff like that, and I am currently 35 weeks pregnant, and I wanted to come on here and say a little story time. So when I was 24 weeks pregnant, which is about 9 weeks or so ago, I want to say like January 5th, I ended up going to the emergency room because I was having a lot of back pain, and my right side, the pain would go from the far back all the way to the top right on my upper stomach. And so that was very concerning for me because I wasn't sure what was going on, and I was like, am I in labor, or like, is it just like Braxton Hicks contractions? What is it, right? So I also had blood in my urine, and that was very concerning to me because I wasn't sure what was going on with me during that time. And like I said, at that time I was 24 weeks pregnant, so I just wanted to play it safe. I ended up going to the emergency room. When I went to the emergency room, I had explained to the ER doctor what my symptoms were and how I was feeling. They ended up doing an ultrasound to check for kidney stones. They did some blood work, and they did a urine test. My culture came back as a potential UTI, but they said to follow up with my primary care doctor in order to continue monitoring that. Also, when they did the ultrasound of my abdomen, they didn't see anything, but they said that I could potentially have kidney stones at that point as well. The next week after that, because this was on a weekend, on Monday I called my PCP and I set up an appointment to follow up again with the OB. They did another urine test, and my provider at that point also provided me with Keflex, which is an antibiotic that they asked me to take. However, they said, go ahead and fill it. We're going to run another urine culture. Depending on what that tells us, if you have a UTI or not, then go ahead and take it, but just fill it so you can have it in hand. 2 days later, the provider calls me and says, you know what, you don't have a UTI. Don't take the antibiotics. Just dispose of them. And I said, okay. I decided to save the antibiotics. Later that same week, on another Friday again, at that point, I was 25 weeks pregnant already. I ended up returning back to the emergency room, and I ended up telling the other ER doctor that was there about potentially having kidney stones or having a UTI. And I was still having blood in my urine, which was concerning. During that time, they re-prescribed me the antibiotics. However, I still had them at my house. So I told him, like, I have them at my house. I can just take the ones that I have and run its course. So that's what I did. And that was at 25 weeks. The following week after that, around January 26th, I was 27 weeks pregnant. I returned back to the emergency room. Third time, on another Friday. This all happened on weekends. During this time, again, I had told them, they asked me if I had taken the antibiotics, and I said yes, I did take them. And they asked me if I completed the course. I said yes, I just finished it like 2 days ago or something like that. At that point, I was still having blood in my urine, back pain. It's just uncontrollable. At that point, I was 27 weeks. Then I went to the ER. Part of the testing was to do another ultrasound to check my kidneys and just like my abdomen to see how that was doing. They weren't really checking for the baby because I was on the baby monitor. So it was more of trying to figure out what was going on and if I really had the kidney stones. So when they did the ultrasound to check for the kidney stones on the right side, we saw 2 7-centimeters kidney stones that were creating a blockage in my uterus, which is the connection between the kidneys itself and the bladder. At that point, they didn't really say much. It took a couple hours to come up with a plan. Their plan was to let me go through the cystoscopy procedure, and during that procedure, they put me under general anesthesia, so I didn't feel anything. However, they did an electric shock wave to help me break down the kidney stones. After they did the electric shock waves to help break down the kidney stones, they also ended up inserting a stent in my right side uterus to help keep the uterus open so that the kidney stones would pass on their own. During that time, I had the stent for 3 weeks. I continue to have blood in my urine, and I was also dealing with a lot of pain on my right side. It was very uncomfortable. Being pregnant is already sometimes uncomfortable. Having that stent inside of me made it even more difficult to continue on with my everyday routine. After the 3 weeks, it was time to go see the urologist in his office versus the hospital. At 31 weeks, they ended up taking out the stent. The procedure basically took about 10 to 15 minutes at most. However, at that point, I was not under general anesthesia. They did give me some local lidocaine, which I feel like didn't do anything because I felt everything. When they ended up putting in the scope to locate the stent, I felt burning, pressure, and a little bit of pain. But it took about maybe 2 to 3 days after the stent removal for me to begin to feel normal and really enjoy my pregnancy. I'm not really sure why the kidney stones happen or why they develop. The doctors there said that it was part of a hormonal change due to the pregnancy. Besides that, in my lifetime, I've never underwent a surgery or any of that. I do have 2 other children, which my pregnancies were normal. I didn't have any other issues. So this is my 3rd baby, and I think I'm okay now because now I am 35 weeks and I don't have no more blood in my urine. I don't have any more pain besides, you know, the cramping that comes along with pregnancy. But it's nothing compared to the pain that I was going through at that point, which was very difficult for me to deal with because I had so many unanswered questions for like 3 weeks. They didn't know whether I really had a kidney stone or not because they couldn't see it. And then they didn't really know if I had a UTI or not because they had me on these antibiotics, and so I took them. But definitely was an experience for me. And if anybody else is dealing with this, be persistent about talking to your provider about it, and just continue to follow up because these blockages could also create kidney failure, you know, because it's creating a blockage and you're not flowing correctly. So my experience with this pregnancy and this whole procedure was very emotional and just was very hard for me to deal with. I think it really puts you in a vulnerable place, but the support that I had really helped me deal with everything that was going on around me and the pregnancy. But I'm on track to deliver my baby in the next 5 weeks or so, and I haven't had any complications after that. I'm excited for my baby to be born in the next 5 weeks or so, and I will continue to keep you posted on how that goes. My plan for my delivery is to have a natural birth. See how that goes. Wish me luck. I hope you like this video. If you have any questions, let me know. I am not a medical professional or anything like that. However, I'm just talking based off my own experience and what I had to deal with. When I was looking for answers on the internet or like videos or reviews of women who have dealt with this during their pregnancy, there wasn't really much for me to see. So I wanted to create this video for everyone or every other woman or partners that are out there and are dealing with kidney stones during pregnancy. You're not alone because I dealt with it. And it's something that is going to create a lot of pain, a lot of emotion, a lot of unanswered questions, a lot of uncertainty. But continue to advocate for yourself and continue to put pressure to get answers and really get to the bottom of either pain or whatever it is that you're having during this time. So thank you for watching. Bye.